Hello and welcome to New to the Street. I'm Janet Alvarez, your host, joined today by a very special guest, Kirk Huntsman. He is the CEO of a fabulous and innovative healthcare company called Vivos. Kirk, welcome to the show.
Thanks, Janet. Glad to be here.
So, Vivos is very focused on what is a troubling issue for so many people, obstructive sleep apnea. Tell us how big of a problem this is in American society and how big the market is for your solutions.
Well, obstructive sleep apnea is a global problem. They estimate that 1 billion people around the world are suffering from this condition. In the United States, it's about 80 million, and that's adults. If you take into account the children, there's another 10 million. So, we're approaching 100 million people in the United States that are suffering from this disorder. And so it's a very big problem. But the interesting thing is that's just the tip of the iceberg. There's so much more. When patients present with OSA, or that's their main diagnosis, they have all kinds of other things that are going wrong in their life. We talked a little bit about, the bruxism and some of the teeth grinding and things. All that stuff is related to obstructive sleep apnea.
So when you say the tip of the iceberg, what other sorts of conditions relate to OSA that can be treated directly or indirectly through your solutions?
Well, it's so interesting because OSA was first diagnosed and showed up in the medical literature about 1965. So in the last 60 years, we've discovered over 40 different comorbidities, meaning things that coexist in the human body when OSA is present. And so we're talking about diabetes, cardiovascular disease, hypertension, Alzheimer's disease, dementia. So it's mental health, it's physical health, it's hormonal health. It touches all aspects of our human existence in terms of our health and wellness. So when we address sleep apnea, we're really addressing in a holistic way, we're addressing many, many things that are going wrong in our bodies.
So tell us a little bit about how you're raising awareness of OSA and of Vivos solutions.
Well, I'm coming to you, right? I'm here right now, right? I'm here right now talking about it, right? We need a bigger platform. Social media is going crazy with this because there's a whole new generation. Interestingly, our fastest growing market is amongst the Gen Z and millennial.
That's interesting.
Yes, you think about OSA as maybe an old person's disease or somebody who's overweight. No, it's endemic. It is all over the place with the younger generations. And so we're treating patients. They're literally flying in from around the world to get treatment. We're located in Denver, Colorado. We have providers all over the country, but most of our social media talks about what we're doing in Colorado. And so we get people from all over the world flying in to get treatment because this is such a need all over the world.
So talk to me about the Vivos product, but it's not just a product, it's also an integrated protocol for improving airway health.
It is. So we call it the Vivos method because what we have is a patented oral appliance. It's the first oral medical device that has ever been, they call it cleared by the FDA. So it's gotten an FDA clearance to treat severe sleep apnea in adults and moderate to severe in children. So we have sort of a leg up on this whole oral appliance treatment side of the market. And what's really interesting is that what we're doing has never been done before. We're actually remodeling the human airway. I asked you before we went on the air if you'd ever seen a human airway, and I wanted to just show you this really quick. But this is an airway. This is a human airway. Mm-hmm. And if you think about it, when you lay back, and you can imagine how easy it would be for that very thin little airway to collapse. Mm-hmm. And you can see that this is the same person, a 59-year-old male, and this is the size and shape of that airway after about 10 months of treatment. So you can see how much bigger, how much less prone to collapse that might be.
That's a significant difference, yeah.
It is bigger,
and,
yeah.
For those of you out there in the audience, it's kind of maybe a little bit hard to see the difference on camera, but it's significant. And you can imagine how, if you're talking about this tiny little airway, this is a significant improvement in terms of the percent of
air that can flow through.
Can flow through.
And so what we do is we non-surgically do this. This is what our little appliances do. And it's a one and done treatment. So once you get this treatment, and it takes about 9 months or so, 12 months. Once you get the treatment, you should be done for life.
Wow.
Unless you go out and add on 100 pounds or 150 pounds, you're going to be fine. And many patients lose weight while they're going through this treatment.
That's incredible.
So it really is. It's fascinating. And it also will help with people that have TMJ disorders, bruxing. You mentioned, bruxing your teeth and all that sort of thing. These things they're so common. Everywhere I turn, people have something going on where they're not breathing properly, they're not sleeping properly, they're grinding their teeth, they have excessive daytime drowsiness. All of these different things are linked back to our ability to breathe properly and sleep deeply. And that's what we restore.
And you're right. You and I were talking about that right before this conversation. I grind my teeth, and I know a lot of people do. Young people, older people, across all ages. And so obstructive sleep apnea (OSA) really is something that affects people across generational gaps, across wide swaths of society. We don't really take it as seriously, perhaps, as we should in terms of what it contributes to our well-being and our overall health. But I wanted to talk to you about this from the perspective of investors.
Sure.
For investors.
Yes.
What is the big takeaway? What should they understand about the market size, what Vivos is doing, and the potential returns therein? So
Vivos first came to market with this product about a decade ago, right? So we've been around. We went public in 2020, and I think the street has been waiting for us to figure out how to monetize this. Right? We've known for a long time that we had a superior technology. We've known that we had a solution to this problem, but we haven't been able to monetize it until just recently. And what we've done is we pivoted away from a dental focus, a dental industry focus, where we were relying on professionals to educate their patients. And we realized that's not going to happen. And so what is happening and what we've done is we've pivoted over to addressing patients where they are, whether it's online, searching for something, answers, solutions, alternatives. Maybe these are CPAP patients that don't like their CPAP or that wish they had something else. Or maybe it's somebody that has just been diagnosed with sleep apnea, and that's really where our focus has been. We went and acquired some sleep centers out in Nevada. We have centers, we have clinicians all around the country, but we have patients now where there's 3,000 patients a month that are being tested for sleep apnea right there in our offices in Nevada. And now all these patients, once they get tested for sleep apnea, their first question is, okay, so I've got this condition. It's not going to go away on its own. It'll eventually kill me if I don't do something about it. What do I do? What are my treatment options? And they want to know that they have more treatment options than just a CPAP. For the last 45 years, the only treatment option has been to go into a CPAP. Well, a lot of people don't find CPAPs very appealing, right? Not very sexy, right? Not very appealing to anybody. And so a lot of people are in them only to stay alive, but they wish they had something different. And Vivos comes along and says, how would you like to get out of that CPAP? How would you like to have a solution that it's one and done, you can be in and out of treatment in less than a year, wear this device overnight, every night for the next 6 to 9 months, and then you're done. And for the rest of your life, you can breathe deeply, sleep deeply, and have just an improvement in every aspect of your life. That's amazing. That's an amazing story. So Kirk, if I'm an investor and I want to learn more about Vivos, I want to learn about the opportunity from an investing perspective, where can I go? Well, Vivos.com has a great little we have an educational website there, and we have a lot of different, obviously, resources for investors to look at. We have some PowerPoint decks and other things that we've given presentations in the past. So I'd say just start to dig a little bit. You'll find lots of people are talking about Vivos, and we shouldn't be too hard to find out there. Kirk, thank you so much for joining us today. All right, thank you for having me. And thank you for joining us on New to the Street. We hope you've enjoyed this transformative healthcare story that Vivos presents, the opportunity in OSA and in treating so many other related health disorders. Here from the NASDAQ market site, I'm Janet Alvarez.